days and vomiting 1 day. One case of insulin-dependent diabetes mellitus diagnosed 2 years ago with poor compliant and follow-up. According to mother, patient developed abdominal pain, which was sudden in onset, low intensity, generalized, and not radiating to any side. It is aggravated by taking any sugary food and not relieved by taking any medication. There is history of history of vomiting 4 to 5 episodes per day, usually white in color, containing food particle, and it is aggravated by taking food and not relieved by taking medication. Along with this complaint, there is associated polydipsia, polyphagia, and increased blood sugar, usually in the range of 4 to 500 milligram per deciliter at home, and usually checked by mother with the same glucometer. With this complaint, there is no history of fever, sore throat, chest infection, loose motion, altered state of consciousness, difficulty in breathing, burning maturation, hematuria, loose motion. For this complaint, patient went to the tertiary care hospital in Lahore, where BSR was checked. It was high, and the patient was investigated in the form of blood test and urine test, and managed in the form of IV fluids, IV insulin, and IV medication. And some tests were sent outside the hospital. Patient and kept NPO. Patient shifted to the ward. After 2 days, patient shifted back to the insulin regime. After back to the subcut insulin regime, and patient taking food and dietary restriction advice and diet chart advice. And there was no plan for discharge till yet. And actual history of the patient dates back at 2 years ago when patient developed polyuria. It was for 2 months. It was 10 to 12 episodes per day with a nocturnal night awakening, usually increased frequency of urination. But it was associated with the polyphagia, polydipsia, and it was associated with polydipsia, polyphagia, but there is no history of any trauma, head trauma, any joint deformity, drug intake. Prior to this illness, there is no history of an infection, mumps, recurrent chest infection, and drug intake. Patient had one episode. Patient had one episode of altered state. After 2 months, patient had one episode of altered state of consciousness and respiratory difficulty. For this complaint, patient went to the tertiary care hospital, where where BSR was checked, and it was high. And the patient, after investigation, patient was diagnosed as a case of diabetes mellitus with diabetic ketoacidosis. Patient remained admitted for 15 days, and some blood tests were done. And but mother does not know about the test details and reports. And died after that. Patient discharged on subcut insulin 7 unit pre-meal 3 times before a meal. And the proper follow up was advised, and diet chart and dietary restriction are also advised. Insulin is advice, but insulin is usually injected by the mother and the patient herself. Mother has adequate knowledge about the insulin storage, administration, changing needle, changing site, but she doesn't have any knowledge about the signs of hyperglycemia, hypoglycemia, sick day rule, dawn, somogai, and increased dose in the party. After 1 year, patient had increased dose in the party. Patient has disease complication in the form of short stature, but there is no tingling. Disease complication in the form of short stature, hyperglycemia, DKA, but there is no history of tingling sensation, tingling sensation in chest infection, increased heart rate, or visual problems, and visual problems. After visual problem, there is history of one admission 1 year ago with DK for remain admitted for 8 days, and after discharge on insulin subcut insulin regime of 5 units of long acting and 7 unit of short-acting pre-meal 3 times. Patient they don't have they don't follow any proper OPD visits. They don't maintain any blood glucose chart, and no eye examination, and patient is not following any dietary restriction. He is taking sugary food along with this. Patient activity of the patient life is impaired. Patient left the school from last 2 years due to this illness, and patient born by a SVD, and with the born by SVD, no history of any gestational diabetes. He is properly immunized, and he is taking 1700 calories in last 24 hours, and they belong to there is a father, he's a product of the consanguineous marriage, and he is the third in the siblings, and there is no family history of the diabetes. There is no family history of diabetes. They belong to the average socio-economic section, living in the own house. Father is a employee in the Dubai, and they bear disease burden by themselves. And mother has patient has irritable behavior and anger issues with the siblings, and mother has inadequate knowledge about the disease, and she is concerned about the disease progression and further management. My patient is 14 year of age, lying comfortably on the bed, lying comfortably on the bed with no respiratory distress or any dysmorphism. He has obviously short stature, and his height is 120 centimeter, weight is 24 kg. These are below third centile. Respiratory heart rate is 100 per minute, respiratory rate is 20 per minute, blood pressure is 100 by 60 millimeter of mercury, and he is afebrile. And there are multiple prick marks present on the fingers, but there is no clubbing no clubbing jaundice, lymphadenopathy, oral dental hygiene is good, no sacral pedal edema, no alopecia, abdomen is soft, there is no visceromegaly, chest is bilaterally clear, both heart sound are audible. There is no normal tone power reflexes. CNS is intact, and no joint deformity. Other examination is unremarkable.
Okay. Anything else you want to tell me?
Ma'am, I forgot to tell about the association of celiac disease and Addison's and associated problems in the history.
Anything else you want to tell?
I would like to do the fundoscope examination.
Okay. What is the hydration status of your patient?
Ma'am, patient currently not in severe dehydration.
So you wanted to look for severe dehydration?
No, ma'am, patient is not in severe dehydration state at the time of admission.
What is my question? What is the hydration status of your patient? What is hydration status of your patient?
No dehydration. In his there is no sunken of eyes, acidotic breathing.
Okay, so at 14 years of the age, you will look for which signs?
11 year of age.
Okay, in your history, you told me 11 years, but in your examination, you told me about 14 years.
11 years.
Okay, so is your patient dehydrated or not?
No,
Okay.
it was not dehydrated.
Okay, so what is the cause of the abdominal pain and vomiting in your patient?
Ma'am, patient is not compliant to the dietary restriction, and mother told about he is taking sugary foods, sugary drink. After that, patient developed abdominal pain and vomiting.
Okay, So, what is the cause of the abdominal pain and vomiting in your patient when he presented to the hospital?
Increased blood sugar.
It is
And
increased blood sugar.
yes,
Okay,
ma'am, but
what was the blood sugar level when he arrived in the hospital?
it was high.
Okay. Was your patient in decay when he presented this time?
Yes, ma'am. Seems the more mild to moderate decay.
So he was not. What is the respiratory rate of your patient?
Ma'am, at that time of a presentation, he's having 20 per minute. He's not
Okay.
have any respiratory distress or respiratory difficulty at the time of presentation.
When
He's
he
conscious
presented in
alert.
the hospital. Okay.
Yes, he's conscious alert.
Okay. So the cause of abdominal pain and vomiting in your patient is DKA or not?
Yes, ma'am.
It was DKA.
Moderate. Yes,
It was
ma'am.
okay. What are your clinical assessment? You're saying this is a case of moderate diabetic ketoacidosis.
Uh, because patient having a high BSR at the time of
All right.
presentation, but he is not, but he's not in having acidotic breathing and respiratory difficulty, and blood ketone are positive present.
Were positive. They told you.
Were positive.
Okay. So what was the hydration status of your patient when he presented in the emergency in the
So some
hospital?
dehydration due to vomiting. He's
Okay.
not taking tolerating orally.
He was tolerating orally, but he was having vomiting, and the hydration status, according to you, was some
Mild,
dehydration.
mild dehydration.
Okay. So on the assessment of all these clinical presentation, you are saying this was a case of moderate diabetic
Mild,
ketoacidosis. Is it so?
yes, ma'am, moderate, mild to moderate.
Okay. Hmm. What was the site of the abdominal pain in your patient?
Generalized abdominal pain.
It was generalized. Okay. Any aggravating or relieving factor? What was the relieving factor?
Um, there was no relieving factor. He took medication, but there is no pain was not relieved.
Okay. What was the time duration he got relief from this metabolic acidosis?
Sorry, ma'am.
What is the time duration his symptoms they were improved?
Ma'am, 1 day. Abdominal
It
pain
was
for 2 days and vomiting 1 day.
what were the time duration जिसमें बेटा ये सारी चीजें मैनेज हो गई थी
जी
कितने
मैम.
ड्यूरेशन में इसके साइन एंड सिम्टम्स रिलीव हुए?
Ma'am, after 1 day. After
Okay.
1 day, he was shifted to the ward, and after 1.5 day, he is taking food, and all the IV fluids were off.
Okay, so it was 1 day or it was 1.5 day?
Ma'am, mother saying 1 to 2 day, but
Okay, you told us about your patient is having proper follow-up that was advised. What was that proper follow-up?
ma'am,
He's
he was advised proper for he was advised 3 monthly OPD visit, eye examination, HbA1c record, but they don't follow
okay.
from last 1 year.
What was the last HbA1c of your patient?
Ma'am, HbA1 in this current admission, HbA1c was sent, but no report. But from last 1 year, they don't have any HbA1c report.
What was the last HbA1c that was done in your patient?
At the time of diagnosis, it was 11. After
It
that,
was
mother
11.
don't know about the
They do not have.
HbA1c. Yes, ma'am.
Okay. Why did you ask for that? There is no issue of the recurrent chest infection in your patient.
Ma'am, because there is in for the diabetes there is a etiology in etiology, like the history of recurrent chest infection also cause cystic fibrosis for diabetes associated.
So you want to rule out this is cystic fibrosis related diabetes mellitus?
Yes, ma'am, but after 10 years it was
Okay. Is there any history of the loose motion or diarrhea in your patient? That was chronic diarrhea in your patient?
No, ma'am, there is no history of chronic diarrhea, abdominal distension.
Okay. Why did you ask for the trauma in your patient? The history of trauma.
Ma'am, to rule out any head trauma or diabetes insipidus,
Okay. So
because
this
this
trauma
is
was any head
polycythemia.
trauma. Okay. Which drugs you were suspecting the causing all these conditions in your child?
Ma'am, some corticosteroids, anti-epileptics, beta agonist, some Hakimi medication. These can cause
Okay.
problems.
Who is injecting the insulin to your patient?
Insulin injected by the mother and the patient itself.
Okay, you told us she is giving all these things. She has the proper knowledge of all these things, the storage. Okay.
Yes,
Do
ma'am.
they have fridge at their home?
Yes, they have fridge at the home, and she store insulin in the lower uh, side.
Okay. Where she's injecting the insulin to her child?
She injected in the abdomen for 10 days, then next in the both thighs, and she is changing the side after 10 days.
Okay. But when you told us about the examination, you told me there are multiple prick marks, but there is no clubbing. So this gave me an indication like you were looking for the prick marks at this your finger area.
Yes, ma'am, prick marks on finger.
Okay. Was there any hypertrophy or atrophy at the insulin injection sites?
No, ma'am, there is no hypertrophy or lipotrophy at the on abdomen or any other side.
Okay. Is this type 1 diabetes mellitus on your clinical examination or type 2?
Ma'am, it is a type 1 diabetes.
Why?
Ma'am, because for the diagnosis of the type 2, there is mostly present in the second decade, and there is history of obesity, and there is a strong family history, association of
Okay.
family.
Okay. Did you tell us about the family history of your patient?
Yes, ma'am, there is no family history of diabetes.
Okay. So why your now tell me the clear answer. Why your patient is not a case of type 2 diabetes mellitus?
Ma'am, because he is diagnosed at 9 years of age, and he is not obese, and no family history,
Okay.
and normally type 2 diabetes usually not present with the decay, because patient have 2 to 3 episode of decay in the past 2 years.
Okay. What was the cause of the decay every time your patient presented to the hospital?
Then patient is poor compliant, is not following dietary restrictions, is taking dietary sugary foods, juices, 4 to 5 rotis per day along with insulin.
Okay, along with insulin.
Yes, ma'am.
Okay. Okay. So, in which class your patient is studying? What
Ma'am,
about the
my
academics?
patient was student of 2 class, and he left to school from last 2 years due to illness and due to his anger issues and se-
Okay. Is he very much conscious about his body shape?
sorry, ma'am.
Is your patient very much conscious about the body shape?
Yes, ma'am. He concerned about his short stature.
Okay. And what about the injection of the insulin? What are the psychological impact of the injection of the insulin on your patient?
Ma'am, he can easily inject via pen.
Okay. Is he injecting or her mother is injecting?
Ma'am, both are inject, mother
Okay.
and son.
Okay. When did he first inject it by himself? At what age?
Uh, at 10 years,
Okay. So for the last 1 year, he has been injecting by himself
or along with mother. Sometime
along with.
mother and sometime.
Okay. What about the joint examination of your patient? Was that normal?
Joint examination, there is no joint deformity.
Which joint you have checked for?
Ma'am, metacarpal phalangeal joint, MC.
Okay. Why you examined the abdomen of your patient?
Ma'am, I want to look the any signs of lipo or lipodystrophy
Okay.
and any color discoloration or stria marks or any visceromegaly.
Okay. Why you examined the eyes of your patient?
Ma'am, there is strong association of retinopathy when after with the diabetes mellitus. So I want to
After
look
2 years?
after 2 years, 1 year for screening purpose.
Okay. So what you were looking for? One is
Uh,
retinopathy, another one?
yes, ma'am, retinopathy and ma'am has two types, progressive or non-progressive
Okay.
changes.
So any other
Cotton,
finding you were looking for in the eyes of your patient?
ma'am, in diabetes patient develop cataract as well.
Okay. So what test you have done to look for the cataract?
Slit lamp examination. Up and down.
So you would like to go for slit lamp examination to look for the cataract?
Yes, ma'am.
What is leukocoria? What is white eye reflex?
Ma'am, after when we look with the fundoscope, there is a white eye
Okay.
reflex and it shows cataract suspicion of. Sorry, ma'am.
Okay. So let's come to your viva. What is your diagnosis?
My diagnosis is type 1 diabetes with diabetic ketoacidosis
Okay.
complication.
What differentials you have ruled out in your patient?
Uh, acute gastroenteritis,
Okay.
diabetes insipidus,
Sorry, the next one.
diabetes insipidus,
Okay.
gastroenteritis.
Okay. So you have ruled out just acute watery diarrhea, acute
Yes, ma'am.
gastroenteritis, and diabetes
Acute
insipidus.
gastroenteritis are di- uh, diabetes insipidus.
Can this be a case of UTI?
Yes, ma'am, but there is no history of burning maturation or hematuria and
Okay. Was there any discomfort or complaints of the any urinary complaint in your patient?
no, ma'am. Increased urinary frequency just due to
So
polyuria.
can this be a presenting complaint of UTI in any
Yes,
patient? Can this be the presenting complaint of UTI in any patient?
yes, ma'am.
Okay. So any other differential that was in your mind, the patient coming to you with the vomiting and with the abdominal pain.
Ma'am, acute gastritis, or
Can this be a case of appendicitis?
UTI.
UTI.
Yes,
Can this be a case of appendicitis? Acute appendicitis?
yes, ma'am. It can present with the appendicitis, but
So what
on
features they were not
uh,
present?
ma'am, no, patient doesn't have fever
All right.
or tenderness on examination because
Okay.
pain was generalized.
Okay. Has he taken any medication, any painkiller to relieve the abdominal pain?
Ma'am, mother gives history of syrup spasler.
Okay. So can this be a case of acute appendicitis that may mask this tenderness or pain in your patient? He has taken
But
multiple
ma'am,
painkillers.
yes, ma'am, but in appendicitis, there is severe intensity of pain and patient having low intensity and generalized abdominal pain.
Okay. Have you done any clinical sign to rule out acute appendicitis?
No, ma'am,
Okay,
Not
all right.
think about
Okay.
appendicitis.
How will you investigate?
Ma'am, first of all, I will review the previous lab, and if patient present in DKA as my patient, and I will look for the blood sugar level, ABGs, arterial blood gases, complete blood sugar, arterial blood gases, urine examination, urine for ketones.
Mm.
Then for further investigation to rule out any infection, complete blood count, and renal function test, liver function test, and for the at the time of diagnosis, I also do ECG for the changes of potassium. And
Okay.
later on for the disease complication and association, for the association of disease related condition, I will for the thyroid profile, and uh, t- uh, tissue transglutaminases, TTGs, and
Okay.
for the complication of disease progression, like retinopathy, to for eye examination, and for coronary artery or cardiac status, cardiac.
So you want to go for cardiac status assessment in your patient who is just 11
Then
years
later
old?
on, patient can develop coronary artery as a complication of diabetes.
Okay. So you have ruled out any microvascular or macrovascular changes in your
Yes,
patient?
yes, ma'am.
Any?
Microvascular.
Okay. What are the indications of the macrovascular to look for macrovascular complication in your patient? What clinical signs you have assessed in your patient that you should go for cardiac assessment of your patient?
Ma'am, patient have respiratory difficulty,
Okay.
and uh, tachycardia.
Okay. Okay. Any other investigation? Would you like to go for serum electrolytes?
Serum electrolytes, renal function test,
Okay.
liver
Why you want
function.
to look for renal function test and liver function test?
Ma'am, renal function test for diabetic nephropathy. Patient can develop diabetic nephropathy.
Okay. So to look for diabetic nephropathy, you will go for renal function test.
Yes, first of all, renal function test.
Okay. So what is the first test to look for nephropathy?
GFR,
Is this GFR? Any urinary test you want to go for that?
urine complete,
To look for what?
glucose, urea.
Glycosuria is to look for nephropathy.
Oh, ma'am.
Okay. All right. Any other investigation?
For disease related complication, ma'am, or
Okay. How will you manage this case?
ma'am, first of all, I will uh, uh, admit the patient in my ward, and involve the multidisciplinary team approach with I, myself, pediatrician, social worker, staff nurse, and endocrinologist.
Hmm.
Then I will treat the acute problem. Uh, then I will counsel the parents regarding the disease complication progression, and also advise proper dietary restrictions and proper follow up after 3 months. And I will counsel the regarding the disease related complication, disease progression, and monitoring of blood sugar.
Okay.
Some supportive. Then, ma'am, I will treat according to the patient condition. After treating acute problem, advise follow up.
Okay. What you will advise in the follow-up?
Ma'am, and follow up, I will advise proper insulin dosage and it's compliant. And then I will advise examination, 3 monthly HbA1c record, and proper follow up in OPDs, dietary restriction, and enforcement of dietary charts.
Okay. Any other thing you will tell your patient?
Ma'am, about complications,
Okay.
signs
So
of
that will occur after.
hypoglycemia, symptoms of
Yes.
decay,
Very good.
and
Okay.
sick day management, and
Okay.
when to increase and when to decrease the dose of insulin according to the condition, when to take
Okay.
sugary by oral.
Okay. So you will tell about the hypoglycemia and hyperglycemia management.
Yes,
Any
ma'am.
other
Okay.
part of the counseling?
Yes, ma'am.
Any other thing you will tell to your patient?
Ma'am, dietary restrictions and growth for growth
Monitoring that could be done by the OPD clinics.
yes, ma'am, on OPD clinics.
Any other
After,
thing you will tell her?
uh,
What will you tell him about the activity, about the
yes,
exercise?
ma'am. I also tell about the in exercise condition while playing, when to adjust insulin dose while playing.
ओके ओके चलो ठीक है डॉक्टर राबिया ये सारा हो गया आपका दिस लॉन्ग केस जस्ट 1 मिनट की डिस्कशन को